people today and why this campaign is so important. Is that if we don't have the whole of healthcare approach, if Medicare and Medicaid is ignoring people with obesity, how the hell are they going to afford this? I mean, I'm lucky. Like I said, I had that old type of insurance, right? But people are not so lucky with their healthcare. And thank God we have Obamacare now, the Affordable Care Act. But you're talking about Medicare not covering this. Medicaid, people need help, and they need help like yesterday. So how do we raise what I call raise the level of awareness? And Shavon, I know you're going to take it over from here and give me some opportunities to take a little break now, because I don't want to tell y'all all my business. I want y'all to come over to my house like Victoria's Secret and see my secrets, because this isn't the boudoir. But I just want to know, how do we get people to figure out that this is so urgent that we got to move, and we got to move now?
So I think the sense of urgency, if COVID doesn't bring about that sense of urgency, it's hard to imagine that anything will. And the reason I say that is because I've had more people talk with me about obesity in the past year and a half since the pandemic than ever before, because people are starting to realize living with obesity is a risk factor for lots of other problems. And now it's a problem for acute, sort of an acute issue when it comes to being hospitalized and having more severe symptoms with COVID. And we've been busier than ever in terms of trying to help people manage that risk, because again, this is now something that you see the impact that goes across a number of people, goes across race, age, religion, political affiliation, doesn't matter. And so I think there certainly can be a sense of urgency coming out of the pandemic. I don't ever like to say there was any silver lining or anything that's good coming out of this, but I do think if this doesn't give us that sense of urgency, especially when we think about it in the context of disparities, right? African Americans are dealing with higher rates of obesity. We're also dealing with higher rates of severe infection from COVID. And I believe that the issue of obesity is contributing to that. And so we do have to be activated as a community in order to be able to address this and prevent this type of disparity from continuing. And that should be our call to action. I think that should be our call to urgency.
And I appreciate you saying that, because like I said, obesity is a disease. It can rob you of your health, and it can rob you of your life, the best years. And we need to act with a sense of urgency. Shavon.